Okay.
Okay, it says we're live stream, but it's not showing up yet. So it's we're live. We're live, Andrea.
I'm glad I'm alive.
We're alive. It's alive. So anyhow, welcome to the webinar, Andrea, and thanks for coming with me every week and doing this. And for those of you that are joining us on Facebook, thanks for being here. Those of you that are watching a recording of this, thanks for taking the time to listen.
Yeah, we have a great topic for today.
I think each week we try and bring important topics, top of mind awareness, TOMA, they used to call it when I was doing my radio ads. Top of mind awareness. We try and look at what's the latest concerns that people have about their health, and we talk about it.
Yeah. So we're going to talk about cardiovascular and high blood pressure today.
Cardiovascular and high blood pressure. Last night before I went to bed, you always give me a hard time. You say, Kurt, why don't you let me know what we're going to talk about? The day before, the night before. I'm like, most of the time I don't know what I'm going to talk about. I just kind of wing it. I run by the seat of my pants, and so last night I went to bed and I'm like, I don't know what I want to talk about tomorrow. And I woke up this morning, I still didn't have a topic in mind. And so when I asked you and I said, hey, Andrew, what do you want to talk about? And you said, high blood pressure and cardiovascular, like, perfect. Yeah, because,
that's why you do things with friends.
That's right. Because they can stir up the pot. They can make things happen. So
sometimes, yep.
I was looking up some numbers today. I don't know if you looked up some of these numbers as well, but I looked at some of those numbers. 1/3 of the deaths in the United States is caused by cardiovascular disease.
And the funny thing is that statistic's been out there for so long, and that particular problem just never drops down in the list, does it?
No, check this out. It's been the leading cause of death in the United States since 1920.
1920.
Since 1920. So over 100 years, it's been the #1 cause of death. Yet for every dollar that we put into cancer research, we only put like 10 cents into cardiovascular research, right? 100 million Americans have cardiovascular disease. They're saying by the year 2035, which is 15 years from now, one generation from now, less than one generation from now, they're saying 45% of the United States population is going to have some form of cardiovascular disease.
We're going to have to make some big changes, aren't we?
That's almost half of Americans. They show that 95%. No, sorry, I read my writing wrong. 95,000 Americans have high cholesterol. That doesn't seem right either. I don't know. I can't read my writing. A lot of people.
Doctor writing.
Yeah, I can't even read my own writing. The cost of treating cardiovascular disease per year is $318 billion.
Okay.
The cost of lost work and employment and productivity in the United States per year, $237 billion per year. So together, that's $550 billion a year. It's huge. It's huge. They're expecting that number is going to go up by the year 2035. So remember, I said 550 billion right now. They're expecting that number to go up to 1.1 trillion in the next 15 years.
Yeah, how about that?
Yeah, I was looking at those numbers and I'm like, wow, right?
Mm-hmm.
So when you said this was a topic for today, I thought, I thought it was important. But when I looked at the numbers, I'm like, holy crap, we should be spending every other week talking about something to,
I don't know if we can inspire enough people, because it seems that it's been an ongoing problem for a long time.
Right? It's one of those things that you'd think that people would get it and you wouldn't have to talk about it, right? Like a friend of mine, he's a ophthalmologist out in Wisconsin, and he and I were talking about, what's going on in the world right now, and I said, he's pro-vaccine, which is cool, I mean, everybody's got their choice, and I said, what if we took and we just educated people on what they could do to improve their own immunity,
right?
And naturally, and he said, yeah, but what about compliance? He said, there's lots of things that he tells his patients to do that they can improve their vision and their, risk, lower their risk of macular degeneration and things like that.
Mm-hmm.
And he said, compliance is so low. And I said, yeah, but why do you keep doing it? Why do you don't stop giving preventative ideas to people, even though that, most of them aren't going to do it, right? I mean, it's most. I remember in my clinic, right. I mean, people would even spend money on buying stuff, and then I'd say, well, how's that working for you? And they'd say, oh, I haven't started taking it yet.
Right. I hear that.
What do you mean what do you mean you haven't started taking it yet? You bought it a month ago. You spent your own hard-earned money. Your insurance company didn't pay for it, and you're not using it. No, I just haven't gotten around to it yet. It's like, oh, wow. But, so that's what he said. And I said, but for everyone that doesn't, there's maybe, or for every 10 that don't, what if 2 did?
Yeah, it's just like, when your insurance company sends out those newsletters, you just kind of ignore them until you have an issue they're talking about, and then it's important to you.
Yep. Yeah. Well, and like the Dalai Lama said, he said, we Americans, specifically talking about Americans, he said, we spend all our lives working our tails off, working, never taking a break, so that we can retire at the age of 60, 65 and go out and spend all the money that we've saved to enjoy life. But we get to that time of our life, our golden years, and we spend all our money trying to find our health that we neglected all that time that we were working.
Right. So we're bringing you this topic today so you can think about some things and make some changes.
So, I kind of looked at a few things, here, and some of the things that we want to talk about: high triglycerides, diabetes, high blood pressure, smoking, weight, diet, exercise. Those are all things that are important when we're talking about the topic of high blood pressure and cardiovascular.
They're contributors.
They all do. And probably the easiest one to change. Well, I don't know. I mean, I can't say easy. It was easy for me to quit smoking. I mean, I just decided that, hey, it was time. I quit. 30 days later, I was a non-smoker.
It's actually harder to quit smoking nicotine than it is to quit heroin.
Than it is to what?
To quit heroin.
Oh, really?
Yeah. Well, that's what they taught me in my drug class at Central Michigan University.
Wow. I can believe it. I can believe it. Back when I went to college back in the 90s, in 80s, I guess, and then continuing education in the 90s, they were talking about, what do you want to call it? The drugs, introductory drugs that get you into being a drug addict. And smoking, they did say was as probably the first line of getting into the drug scene.
Well, there's a lot of, if people are determined, there's a lot of ways to do it out there. You and I both know about laser therapy, and I used to be a technician for that and had great success. I think everybody I lasered quit smoking, so that's something to look into.
Yeah. Well, so smoking is probably, the easy one. And again, it's easy for me. It might not be easy for you. But there's ways, and then weight is another one that, you can really lower your risk factor for a lot of things by your weight. And, boy, you and I've talked about diet, and we've talked about things like that a lot, spent a lot of time on it. And
We have, and you know, people can scroll back into our lives on the Facebook page or your YouTube channel, find all those videos, you know, and watch them. We talked about keto many times. We talked a little bit about carnivore diet. We talked about, you know, using some supplements that Sizzle provides for us to augment all of that. So, you know, you just have to be determined, flip that switch in your brain that I'm going to do it.
Yeah. So I was looking up, you know, one of the things that we hear a lot about is that, you know, we hear a lot about plaque buildup and things like that. When you think about cardiovascular health, you know, naturally you kind of think of blood clots, you think of heart attacks and strokes and things like that. And so I was looking up, and I wanted to be able to, you know, give people information. How exactly does this all happen? How does that blockage in artery happen? How does it trigger an embolism? How does it trigger a stroke? How does it trigger a heart attack? Right. And so I thought I'd just kind of quickly run through that. And so you have these risk factors, which we talked about, you know, smoking, sugar, toxins, different things like that. But you have these different risk factors that cause injury to the blood vessels.
Right.
And that's how it all starts, is you have injuries to the blood vessels. That causes inflammation. That causes inflammation. We hear a lot about inflammation nowadays, the cytokine storm and all these different things. We talk. So this is top of the mind awareness type thing. This is what's happening in the news. So it causes inflammation. That sends a trigger back to your brain. It causes some biofeedback type signals. And what that does is then where that inflammation is, where that injury is in the blood vessel, what it does, it causes a plaque to form there. So it deposits
it sends platelets and kind of just makes a bandage over it, right?
Yep, like scar tissue. If I cut my hand, you know, like I cut my hand here, you can see the little scab, and that's what happens inside the blood vessels. So inside those blood vessels, you get kind of that scab formation. And as the blood rushes by, you know, every you know, second, you know, your heart pushes the blood through there. What happens is that fats go by, and these fats deposit on the plaquing. Toxins deposit in the fat, because most toxins are fat soluble, lead, mercury, you know, things like that. They're all fat soluble, so they get deposited in there. So now all of a sudden that plaque becomes hard.
Right. Inflexible.
Yep. So your artery right in that spot, it gets hard. And so then as the heart beats and it's pushing that blood through there, when it's pounding on it, right, it causes tears in the scab. So if I rip this scab off before it was healed underneath, my hand would start bleeding again.
Right.
And then that sends a signal back to my brain. The brain says, hey, let's throw some more stuff there. You know, I didn't want to use that word I was to say, but throw more stuff there. And that it does the same thing in your blood vessel. So all of a sudden now it gets bigger, it grows, it ruptures, it tears, it breaks, it goes through all of this. The body's trying to repair it all of the time. And all of a sudden you
just like a garden hose or plumbing, like the smaller the diameter, the more pressure. So that causes the increase in blood pressure. Is that correct?
So, yeah, because if you take a garden hose, you go outside, you open the hose, turn it up, put your thumb over the end of it, you know, and you can squirt that water a lot further. It increases the pressure. Exactly. That's what you said. So as it increases the pressure, it increases the amount of pressure at that particular spot. And pretty soon it can cause that to rupture, and it'll break that blockage loose. And that blockage, or that embolism, it starts floating around, and it gets lodged in your brain. That's what we call a stroke. It gets lodged in the little coronary arteries in your heart, and we call that a heart attack. Boom.
Right.
Yeah.
So that's how that works. How do we prevent it?
Oh, we're going to talk about prevention? Why would we do that? Why would we talk about prevention? Come on here? You know, I mean, why would we talk about prevention? My friend Tom says, he says, you know, compliance, people won't listen anyhow.
Right. Well, we're hoping that we'll reach a couple of people out there.
Yeah, if 2 out of every 100 listen, and we can help, 2 out of every 100, it's
Yeah.
worth it. We're here
Like
anyhow.
that story about the starfish on the beach.
Yeah.
A little boy throwing one back. He says, well, that one was happy I threw him back.
There you go.
Yeah.
I forgot about that. Yeah, that's a good story. So some of the things that we can do, number one, probably the easiest thing that you can do is cut back on the processed carbohydrates, cut back on the processed sugars, the white carbs.
Yeah.
Doesn't
If
cost
you haven't
anything.
got the message yet, sugar is poison.
If sugar was invented today, it would be considered a drug.
Yeah, it's poison.
And it's crazy though. If you look back, I've got some old Time and Life magazines from the 60s, and it wasn't that long ago in my lifetime, in your lifetime.
It wasn't that long ago for us. We were alive.
Yeah, we were, but it wasn't that long ago, in the 60s, that there was ads in those magazines that said, hey, do you want to be, the big muscular guy on the beach? Yeah, that was the ad. And it said, eat sugar.
Eat your sugar.
Right.
A lot of false advertising out there. I got
mean,
some in the mail this week.
Back 100 years ago, the average American consumed 12 pounds of sugar per year.
Okay.
Now
it's, let me guess, 156.
Pretty close, 165.
Oh, see, I transposed my numbers.
You transpose those numbers, but yeah, you were close. And who knows, you might actually be correct. I'm just going by what the studies show, but yeah, that's a lot of sugar and carbohydrates. Wow.
It sure is. Sure is.
So cut back on that, because that's something that you can do right away. All right. So what about vitamins? Are there any vitamins that you can take that would be beneficial for helping with high blood pressure and high cholesterol and cardiovascular disease?
I'm sure there are, but I'm not aware of that information.
What about vitamin D? We hear a lot about vitamin D lately. We hear about it with digestive health. We hear about it with bone health. You and I have talked about it with bone health. We've talked about it with immune health just recently. Every time we talk about the immune system, what do you think about? What do you think about that for cardiovascular?
Well, it pretty much affects every cell in the body, is what I heard.
Yep. Yeah. So low levels are associated with. I'm reading my notes that I have here. Low levels are associated with heart disease, strokes, and high blood pressure.
And breast cancer.
Yep. But today we're talking about cardiovascular disease and high blood pressure.
No.
So
I just want to throw that in there.
Yeah. Oh, and digestive health too. I mean, we can
motivate the women. Motivate the women too.
But vitamin D levels, and when you take a look at the studies, they say, oh, here's how much you need. It's the amount that the USDA recommend is so low that it really doesn't do it doesn't do these things that we're talking about. So you can't take I was going to say a name brand, but if you take an over-the-counter vitamin, multivitamin, you're not getting enough.
No.
Because it's getting closer to winter, I'm wearing long sleeve shirts now. Pretty soon I'll be wearing a stocking cap. I'll be wearing a jacket, won't be long. I'll have gloves on. We're supposed to get 20 minutes of whole body exposure of sunlight to get enough vitamin D. We don't get that in North Dakota. I mean, maybe 2-3 months out of the year you could, but even then, depending on your skin color, skin type, are you getting actually enough? So I take in the wintertime, I take 10,000 international units of vitamin D per day.
Yep.
And then in the summer I take 5,000. It's cheap, it's inexpensive, and it's it's easy to take. Okay, so vitamin D. What about your B vitamins? What about like vitamin B9, folic acid, vitamin B6, vitamin B12.
B12 is good for stress. If you lower stress, you have less high blood pressure. You have less systematic stress on the body.
Yeah. So folic acid, vitamin B9, it lowers the homocysteine levels, and homocysteine, of course, is associated with inflammation of the cardiovascular system. They showed that if you take folic acid, it lowers the risk of heart disease and stroke by 20%. That was a study that came out of Japan. 20%, Andrea.
So you get that like in your, if you take a multivitamin, you usually get folic acid in that.
Not
a good
enough.
one. No?
Yeah, not enough. No, no, they, most over-the-counter multivitamins just don't have adequate amounts of anything. It's, I was at a seminar 20 years ago, and we were listening to Dr. Wheeler, and Dr. Wheeler helped formulate a lot of multivitamins. And one of the most popular one that you buy in the market starts with the letter C, over the counter, most popular one. He said he helped formulate that. And he they said, here's what we want to have in it. Boom, 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 boom. And they listed all these different things that they want to have in the vitamin. And they told him what it would cost to make it. And this company said, "Ooh, that's too much." He said, "We want the price point way down here." And so in order to get the price point down, they had to start taking stuff out. They had to start using synthetics. They had to really make the vitamin cheap. So, Dr. Wheeler at that time said that only 3% of people had adequate enzymes and cofactors in their digestive system to actually absorb what was in the product. 3%.
Wow.
So he said the other 97% might as well drive along the highway and just toss the pills out the window. It did just as much good. He said actually it probably did more good because of the form of vitamin E that they used, the form of vitamin E they used actually caused heart disease rather than reversed it. But so B vitamins. What about vitamin C?
Well, vitamin C is kind of the overall vitamin for everything.
It really
before
is.
the 1930s, when certain people took over the medical establishment, doctors were using vitamin C for just about everything with results. Yeah.
Oh yeah, they've shown that you can boost your immune system way up. That's why in the wintertime, you go get vitamin C lozenges with zinc in them, and it helps lower your risk of getting a common cold. That they're saying it. I'm not saying it. The studies are showing it. But so vitamin C neutralizes free radicals that damage the endothelium. The other endothelium, if you've got a blood vessel, this is a blood vessel. The lining inside of here is called the endothelium. And so vitamin C helps reduce the free radical damage that lines the endothelium.
Okay.
That's pretty cool. And so I remember a study. It was I don't remember the exact name of the study, but it was basically it was why don't dogs have heart attacks?
Tell me. Oh, they make their own vitamin C.
They make their own vitamin C. Yeah. And so they show a lot of mammals actually make their own vitamin C. Humans lost the ability.
We're the only ones that don't.
Yeah. And so we have to take it. We have to take it through our nutrition. So then we move into, let's talk about fiber. There's soluble fiber, insoluble fiber, but in the United States, and I'm gonna just talk about the United States because I don't know about all the other countries. But here they say that we're getting less than half of the recommended fiber intake that we're supposed to get per day. And my friend Katie down in Australia, she actually put together an app. She developed an app that you could take and you could throw your food, what you ate, into the app, and would tell you if you got adequate fiber. But fiber helps to lower cholesterol, and it's actually the fiber actually has a better benefit if you exercise at the same time. If time. You don't want to drink fiber and exercise at the same time, but you know, if you do it the same day.
Mm-hmm.
And you and I have talked about omegas, the omega-3s. I mean, how important
Mm-hmm.
are omega-3s? You know, right now they say that we're supposed to be getting, you know, they're recommending a ratio of omega-6 to omega-3 of 4 to 1, ideally 1 to 1, but 4 to 1. But they're saying here in the United States that we're consuming anywhere between 16 to 1 to 25 to 1 ratios.
Right. And what is cardiac arrhythmia? Is that like when your heart is beating incorrectly?
Yeah, it gets out of sync. Instead of going boom,
Okay.
boom, boom like that, it might go boom, 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 boom like that. Yeah,
Okay. So I
like
saw that
a bad drummer.
omega-3 fatty acid research says it significantly reduces the sudden death occurring from cardiac arrhythmia.
Wow,
Mm-hmm.
omega-3 does that. Yeah, and it reduces inflammation. Again, you know, the whole inflammation thing that we've talked about, you know, with people having chronic low-grade inflammation in their body, you know, and that's what's going on in the world right now, is that a lot of people have chronic low-grade inflammation. All of a sudden they get exposed to something that causes this inflammatory effect, and the body doesn't know what to do. So cut back on the omega-6s, increase the omega-3s. You know, I remember it was about 20 years ago. I was at a seminar and they were talking about how people with chronic lower back pain, how they should take between 3,000 to 6,000 milligrams of omega-3 per day.
Wow.
That's a lot.
Mm-hmm. For
know.
inflammation, well, there's a lot of other things you can do for inflammation too. One of them is hydrogen.
Hydrogen water.
Diatomic hydrogen water is great for inflammation. I've taken it and I've used it for like is acute sudden inflammation, or is that long lasting? Chronic is long lasting. Acute inflammation, like an upset stomach and stuff, where you're just suddenly inflamed, in pain. Drink the hydrogen water and it all goes away. You know, but so that just tells you that it works really well for inflammation systematically too. Plus
and you know, hydrogen isn't it considered one of the top antioxidants, even better than glutathione?
Oh yeah, totally. So that's removing all the inflammatory markers, you know, that's causing all the patches in your veins and all that stuff. It also lowers
wait. You can't say that, because now you're making a medical claim. So what you want to do is it supports the system that reduces that. We got to say this. You know, we've had people report us before for making medical claims.
Right.
We have to support the body's system.
Well, research shows that it also lowers bad cholesterol, raises good.
Supports the system that lowered bad cholesterol.
Well, research shows that.
Yeah. So, you know, so hydrogen water, diatomic hydrogen. How about CoQ10? Here's another one.
Yep.
CoQ10. It's an antioxidant. Again, it's found in food. It protects the cells. It's found in every cell in your body. That's how important it is. It's found in every cell, but we tend to associate it with cardiovascular, right? And so a lot of people, they take a statin drug because they get you know, prescribed that. And one of the things that happens when you take a statin drug is it actually lowers your body's ability to process CoQ10.
Right. And that's why a lot of cardiologists put their heart patients on CoQ10.
Would you say it's a lot, or would you say there's some?
I've heard of several.
Yeah.
That's what their doctor recommended.
Yeah. So I would say some cardiovascular surgeons recommend it, you know, but I wouldn't say all cardiologists do it. Not a lot. Just because they're just not versed in nutritional health that much. I mean, that's it's sad, you know, it's sad. You know, my son graduated from medical school and I know he knows a lot about nutrition, but yet he tends to argue with me about nutrition a lot when I talk about it.
Well, just send him over to PubMed, let him figure it out.
Yeah.
He says
Magnesium.
he likes to research.
Magnesium.
Magnesium is an awesome, and everybody should have it for brain and heart health.
Magnesium is one of those things that I think that, you know, they're starting to recognize that it is really important. Like if you go to the hospital today and they put an IV and they bag you and they start giving you an IV, you know, one of the components of that is magnesium, because they know that it's so deficient in people. Yeah, that's right. There's a nutritional deficiency epidemic. Let's call it an epidemic.
You know, we've talked about how you don't assimilate vitamin D without enough magnesium in your system too.
Yep. So you need magnesium and calcium and vitamin D. They all kind of in balance. And so, you know, it's linked to low levels of magnesium, is linked to high blood pressure, plaquing in the arteries, calcification of the arteries, high cholesterol, as well as atherosclerosis, which is hardening of the arteries. Well, those things all kind of go in hand in hand, and you know that we've already talked about how that plaque develops, right? L-carnitine.
Yeah.
You get it in red meat, but it gives the little nuclear power plants of the cells, the mitochondria. It gives it energy, and so it helps to provide that protection for the heart, and so people that have congestive heart failure should definitely be on L-carnitine. They've shown there's a benefit. There's a study that I was reading about, because the L-carnitine increases the O2 levels associated with.
It increases nitric oxide too, right?
Yeah. And so L-carnitine, green tea. I'm looking at time trying to, I got a big list here. Green tea. They've shown that green tea helps to your body by supporting the system that lowers high cholesterol. I want to say that correctly. So what they say is that we should be drinking green tea 3 times a day. And I'm not talking about that stuff that you buy at the gas station,
right?
Loaded with high fructose corn syrup and sugar. Garlic reduces high blood pressure and coronary disease. Putting garlic on your food. Here's one that you want to actually decrease. This is one, and I thought, you know, we're talking about all the stuff that you want to increase. Here's one you want to decrease. You want to reduce your choline levels, because they found that choline increases the levels of this trimethylene N oxide, which causes the platelets to clump together and form clots.
What's choline? Where does that come from?
Choline comes from meats, eggs, and milk. Red meat, eggs, and milk. So let's see what else. Where niacin, nicotinamide riboside, nicotinamide mononucleotide, nicotinaminic acid, right? All forms of vitamin B3. They found that vitamin B3 lowers your cholesterol, lowers your triglycerides, lowers the LDL, the bad cholesterol, increases the HDL, the high cholesterol, and it helps with NAD production, cell signaling, and that is the fuel for the sirtuin genes. And the sirtuin genes do what? You remember all that stuff that we've talked about, how the sirtuin genes repair the damaged DNA.
Yeah. Well, then we have resveratrol.
Yeah. And there's a lot of studies on resveratrol. I turned the page here because I wrote a bunch of stuff down on resveratrol. So there's 2 forms of resveratrol. There's the trans form and there's the cis form. The cis form being the cheaper form, and it doesn't do as good. It doesn't have all the bioavailability that the trans resveratrol does. But they found that trans resveratrol decreases inflammation, protects the nerves, increases the blood flow, and increases energy.
Yep.
Where do you get it?
I get mine from Sizzle.
There you go. But you get it from the skin of grapes. Hey, did you know that I process 50 pounds of grapes yesterday from my dad's grapevines?
No.
Yeah,
Did you
just little.
stomp them with your nice big bare feet?
No, because then I don't think anybody would want to take and drink it if I stomped on it with my dirty
That's
feet.
how they do it in Italy, you know.
Yeah. Yeah. Well, I thought about it, but then I would have to put bags on my feet so that I keep them clean.
Right.
But no, I actually did not. I cleaned mine and I ran them through the food processor, and then I threw them in vacuum seal bags, and I sealed them up until later time when I have time to actually do something with them. But I ended up, well, I think I'm actually going to make brandy.
Oh,
I'm not much of a wine drinker, but I find it gives me a headache. But brandy, I'll make some brandy.
well, wine gives you a headache if it's a low quality wine and it has a lot of toxins in it.
Yeah,
But you're
brandy,
using fresh grapes, so if you do it right, you might not get a headache.
toxin free, non-GMO, organic, all those things. Man, my dad just had to. I talked to a buddy of mine last night, and he said his grape crop was really good too. So maybe with this climate change, that North Dakota will turn into the grape producing capital of the world.
Maybe. Never know.
Maybe. Who
Maybe you'll
knows?
have palm
But
trees.
So there's 244 clinical trials, and here's what the clinical trials show. It lowers bad cholesterol, increases good cholesterol, it protects against blood clots, it decreases blood pressure, it helps protect the blood vessels, it regulates insulin, it decreases cognitive decline, it decreases joint pain, it decreases cellular aging, it increases immunity, and it increases cardiovascular health and protection.
Awesome. Sounds like a bang up product.
Yeah, and if you take it along with black pepper or Szechuan pepper is actually even better. But if you take it with pepper, it actually increases the bioavailability of the resveratrol.
Cool. So I can just put a little pepper in my resveratrol and drink it down, huh?
It's already in there. Tom thought about that. Yeah. So the last one on my list is something called L-arginine. L-arginine. And I let's see, what year was it? Was it the 2008 Nobel Prize, 2007, 2008 Nobel Prize. It was given to a group of scientists for their work on L-arginine. And they found that L-arginine increases
That's the one that increases production of nitric oxide.
Bingo. Yep. Yep. It causes.
And my notes say causes relaxation of smooth muscle, which equals relaxation, which equals vasodilation.
Bingo.
Yeah.
Right.
Yep.
So
flexible blood vessels.
Yeah. So just a quick testimonial. A friend of ours up in northern Minnesota here, he had a lot of cardiovascular issues. He was on a lot of medications, and he started taking L-arginine, and over a short period of time, his doctors took him off his medication.
Sweet. Well, I heard that the guy who actually discovered all of that was a cardiac doctor, and he emptied out his clinic.
Yeah, that's what I've heard too.
Yeah, cool.
Yeah, and that should be the goal. That should be the goal of every doctor. Is they should be trying to get rid of their patients, and so they can bring new ones in, because I mean, as much as we want to say, hey, we solved the problem, right? We decreased the number of people dying from cardiovascular death. There's just going to be another one that's another cause of death that's going to be on the rise, and so what good does it do, Andrea? I mean, what good does it do to lower cardiovascular death? Let's just leave it alone.
Well, in Asia, they pay their doctors when they're healthy, and then when you get sick, you quit paying them.
Wait, should
follow the money.
Yeah. And but like, you know, my friend Tom said last night, he said compliance. He said that's the big issue. It's like, yeah, I agree. Compliance is the big issue. How do we get people to listen? You're not always going to get them to listen, but where do you start? I mean, you start by just giving people the information.
Yeah.
Somebody's going to listen, you know,
Mhm.
and then they're going to pass that information on to somebody else, and they're going to pass it on to somebody else. And so over a period of time, you know, it might make a difference. Like you said, that one starfish, hey, I threw it back in the ocean. That one starfish, it's going to live.
Mhm.
You know,
Yep.
what if we help one person, one out of
Right.
every 100, one out of every 1,000? Hey, we've done our job for the day.
Mhm.
So and
So that
today,
wraps up another Tuesday.
for today, you know, the thing that we want to talk about is that, you know, not only are we affecting those people that have heart disease,
Mhm.
we're actually making a dent on those people that are being affected by this viral thing, because it seems to me that as we're looking at the virus and we're looking at the rate of infection and we're looking at all that stuff, maybe we should be focusing on the cardiovascular component of it, because that's the part that seems to be killing people,
Right.
right? You know,
Yep.
because we're not making a big dent in you know, getting rid of the virus. You
Mm.
know,
No,
I mean,
because it's mutating.
it's
It'll
mutated.
mutate 100 times.
Oh, it's already mutated over 100 times. Yeah, it's going to mutate thousands
Yeah.
of times.
There's
And
several varieties out there already.
yeah, so let's focus on, okay, how does it affect your health? What does it do to you if you do get
Mhm.
a bad, let's say you get a bad infection? What causes cardiovascular disease? So let's go after the cardiovascular disease. Like, again, you know, and like I was saying last night to my buddy, I said, let's go after that, and let's try and prevent one person from ending up in the hospital.
Right.
So, all right, Andrea, let's close the call with that and just say, hey, you know, we've given you the information. What you do with it, it's up to you.
That's right. You can lead a horse to water. You can't make him drink.
All right.
Don't be a horse that doesn't drink.
That's
Okay,
right.
folks. So that's another
Drink your
wrap
water.
up on a Tuesday doctor's call with Doc Bisnick. And thanks for being here, Doc. Tune in every Tuesday at noon Eastern time. And if you can't, catch us afterwards on the Facebook channel page or Doc's YouTube channel, Sizzle World Team. See you there. Bye.